Hello, my name is Dr. Jonathan DePierro, and it's my pleasure to discuss our paper titled Determinants of Staff Intent to Leave Healthcare During the COVID-19 Pandemic, which was featured in the American Journal of Public Health special issue. I'm representing my team at the Icahn School of Medicine at Mount Sinai. So, to set the stage for our paper, there's a very well-documented outflow of faculty and staff, including nurses, from healthcare institutions that was an issue before the COVID-19 pandemic, but really escalated and accelerated after the COVID-19 pandemic. And not only that, but there are documented cases, literature to show that people are choosing to leave healthcare as a field entirely, which is even more concerning for workforce health and the operations of institutions. Prior research on leaving healthcare and leaving healthcare institutions is focused primarily on physicians, advanced practice providers, and nurses. And our study addressed this concern by looking at a wide range of predictors and by looking at a wide swath of the non-physician workforce at one large health system in New York City, the Mount Sinai Health System. In terms of the design of our study, it was cross-sectional in nature. We randomly sampled 30% of the Mount Sinai Health System non-physician workforce, so anyone other than physicians in the health system, any role, in September to October 2022 using email invitations to a web-based survey. We had about a 28% response rate, which I'll come back to a bit later. Our final analytic sample was a little bit over 1,000 members of the workforce, about a third of which were registered nurses. We looked at a variety of different measures, including demographics, role in the institution, self-reported depression, self-reported anxiety, burnout, endorsement of thoughts of being better off dead, subjective well-being, having a mental health service need, exposure to workplace violence, rating of your own leader, and workplace culture. And what we were trying to predict was whether they said yes to the question, do you think about leaving the field of healthcare altogether? So we were looking at essentially a regression model, looking to see which set of predictors carried weight in terms of predicting the outcome to answering this question. 37% of the sample of notes said yes to this item, that they were thinking about leaving the field of healthcare entirely, which in and of itself is concerning. We did a fancy type of regression called relative importance analysis, which looked at the relative importance of a set of predictors from among a large array. And what came as a result of that is that there were top 5 predictors. And the top 5 predictors, and this is the percent of variance accounted for, were burnout, subjective well-being. So if you had low ratings of subjective well-being and high burnout, you're much more likely to say you wanted to leave the field of healthcare entirely. If you were a nurse, concerningly, you were much more likely to want to leave the field of healthcare entirely. If you had low endorsement of workplace culture, your ratings of the workplace were suboptimal, and I'll get into what that was in a few moments. And if you endorse being male. So what do we mean by workplace culture? These are the exact items that our survey participants answered. So they were asked things like, my clinical team works efficiently together. I feel connected to other employees on my team. The environment is a caring one, and the institution puts sufficient effort into advancing gender equity and anti-racism efforts. If they said no to these questions, they were more likely to say they wanted to leave the field of healthcare entirely. So again, this is pointing to a combination of individual and system level drivers. So that was one of our conclusions, that it was a range of different things, subjective well-being plus their perception of the culture. So interventions have to address both. And we're really lucky at Mount Sinai that we are already thinking about this, and we've thought about this for many years. We have a collaboration of many different offices, including our Office of Wellbeing and Resilience, which focuses on leadership and workplace culture and electronic medical record workplace efficiency, and the Center for Stress Resilience and Personal Growth, which was more developed during the pandemic and focuses on individual mental health and team psychoeducation around mental health concerns. But further research is needed on the impact of any interventions that are multi-level in design and their impact on intent to leave. So we need to know, are these things that we're investing money in these programs actually lowering our staff's intent to leave? Because people leaving healthcare institutions has a huge financial burden associated with it. It's a huge hit to operations and a huge hit to budgets of institutions to have to have people go and rehire. There's lost productivity and money spent in the hiring process and onboarding. And we really need to explore methods to increase survey engagement. And I should just say, of note, this really only captured employees who regularly check their emails. And there are many members of the workforce, including, for example, security officers, environmental services, who may not check their emails, but whose voices need to be heard in these surveys. So we've actually been addressing them specifically by going and meeting them in person and engaging them with surveys in person rather than relying on email communications. So in total, this really shows that efforts to address turnover in the healthcare system, or at least thinking about leaving the institution, have to be multifaceted in order to be successful. And I want to thank you for your time and attention to this visual abstract. And I would direct you to the full paper on the American Journal of Public Health website. If you have any further questions, you can certainly reach out to me. This is my email address. And I want to note a couple of sources of support, including a HRSA grant that we were very lucky to get in 2022 and some support from NIH. Thank you.